Today, we'll be talking about kidney stones. Kidney stone is actually a very popular topic in nephrology. We have other names, we call it aside kidney stones. We can call it renal calculi, it can be called nephrolithiasis, it can be also be called urolithiasis. Okay, so what's kidney stone? Kidney stone is actually a hard crystalline minerals and salt that is formed in the kidneys, just as the name implies. Let's talk about types of kidney stones. There are different kinds of kidney stones. We are going to start with calcium stones. Calcium stones, this is the majority of all kidney stones. Like all the kidney stones patients do have, most of them are calcium stone. So what is this calcium stone? Calcium stone is made up of calcium oxalate, and it's being influenced, or it's being caused by our diets. There are some food, there are some vegetables, there are some fruits that are very high in oxalate, like chocolate, some nuts. They are very high in oxalate, and when you consume this in a very high quantity, it can crystallize in the kidneys and result to this calcium oxalate stone. Then the next one we are going to talk about is uric acid stones. This uric acid stone is mostly seen in patients that have lost fluid, body fluid, maybe through diarrhea, there, and also patient has a high protein diet. I think that's the best way. High this protein we are talking about, they are not just normal animal protein. Talking about seafood, talk about organ meats. When I talk about organ meats, I mean the organs you find in the body of this animal, maybe the liver. Do you understand? So this seafood, these organ meats, they contain a very high level of uric acid. When you take this food in very high quantity, it will, and you are not really hydrating well, it will crystallize. Okay, this is when this is how it results to this uric acid stone. Then the next stone I will talk about is cystine. Cystine is, this one is a genetic condition. Okay, it's a genetic condition where the kidneys leaks a lot of protein. So this leakage of protein into the kidneys, it can build up, okay, and form this cystine stone. Then the last type of kidney stone I will talk about is struvite. Struvite is from UTI. What is UTI? Urinary tract infection. When someone have urinary tract infection, it can actually lead to this struvite stone, and this struvite stone develops very fast, and this stone can be quite big too. So when someone have UTI, it's actually good to treat it immediately and adequately, because it can lead to this kind of kidney stone. Let's move to the signs and symptoms of kidney stone. The first one I'm going to talk about is pain. Well, this pain is the cardinal point. Like, this is the main thing in this kidney stone. This is the main symptom. What is the nature of this pain? This pain is heavy, like it's intense. It's not a small pain. Like, I don't know how to explain it to you. It's not a light pain. This is a very heavy pain. It is sharp, and it's like in a wave form. Do you get? So it can you can feel it behind your back here. You can feel it on your abdomen. You know, pain can actually radiate. Okay, that's what we call referred pain, or it can actually radiate. So that pain is the main thing. The second one is you can feel pain while urinating. Okay, so when you are urinating, you can be feeling serious pain, and you know why you are feeling it? Because this stone is passing through a narrow lumen, a narrow vessel. What's supposed to be passing through this vessel is fluid, is your urine, not stone. So that is why it's paining you. And another one is that these stones has sharp edges. So these sharp edges can actually, erode the ureter, like, you understand, the vessel. It can erode it. So then the next, the third symptom we talk about is hematuria. What is hematuria? This is what we call bloody urine. So this period, you might be seeing that your urine is pink, it might be brown, it might be bloody. You know why it's bloody? I mentioned it earlier in the other point. When this you are passing out this stone, when this stone is formed and you're taking fluid to pass it out, this stone can erode the vessels, the ureter, as it's passing. So when it erodes, there's going to be some bleeding, maybe micro bleeding. So it can turn your urine to pink color or make it look bloody. Okay, the next point we are going to talk about is inability to urinate, or maybe urinating little. And it's very obvious. This sign is very obvious because as this stone is formed, it can totally block the urine outflow. Can be done in the kidney, it can be in the ureter. Okay, this flow of urine can totally be blocked. Then, or you can be urinating a little because the lumen, the vessel, maybe the vessel is like this and there is stone like this, so the urine has a little pathway to flow, so you can be urinating a little. The next point, there can be foul, cloudy and foul smell urine. So these are the few symptoms that you can experience when you won't have kidney stone. So how is kidney stone diagnosed? It can be diagnosed by a series of examination. First of all, history taking, physical examination, urinalysis, blood tests, imaging, maybe CT scan, X-ray, ultrasound. This is for the medical people. So when you go to the hospital, your doctor, your healthcare provider knows the right thing to prescribe for you. Okay. How is kidney stones treated? Well, the treatment of kidney stone depends on the size, depends on the type. We talked about types of kidney stone. Then it also depends on the position, location of these kidney stones. Okay, so if it is a very small stone, there are some conservative treatments like hydration. You can be asked to take a lot of water. You can be asked to take 4 liters and above daily. Yes, so that to help flush out this stone. Okay, you can be giving painkillers. Okay, you can be giving painkillers because this kidney stone is really painful. Like I described it, it's actually a very sharp pain. So you need painkillers like NSAID or any kind of painkillers to kind of minimize this pain. They can be asked to increase your physical activity, because when you are physically active, it will help to make these stones move. Okay, then the next one is medical treatment. You can be doing some treatment like maybe alpha blockers. It will like tamsulosin, where yeah, it can help to relax this ureter so that these stones can easily pass. There are some medications like loperidol. This so there's some patients that have gouts. Yes, this gouts, it increases uric acid. Like uric acid tends to be high, so it can be treated like that condition. Okay, that condition like gout can be treated so that it won't precipitate this kidney stone, or maybe it will not cause further further stones. Okay, then we have surgical intervention like nephrolithotomy. This is for very large stones. I said earlier that the treatment depends on the size, the position and the location and the type. Okay, so these are for very, when someone's stone is very large, you can't be talking about just hydration or being physically active. So they're going to talk about nephrolithotomy. There is extracorporeal shockwave lithotripsy. Okay, so there are actually a lot of forms of treatment. Then let's move to prevention. Then in prevention, you have to hydrate. I always mention in my videos that you have to take at least 2 liters, 2.5 liters, 2 liters at least of fluid every day. Then you have to monitor your diet. You don't take a lot of seafood, you don't take a lot of chocolate. I listed it earlier because all this, they have a lot of oxalates, or they have a lot of uric acid. Then you have to be active. So these are the ways you can prevent kidney stones. So thank you for watching. You can do well to subscribe, like this video and leave a comment. Thank you.